Dr. Levy is a board certified cardiologist. He's also a lawyer and a very prolific author. He's authored a number of books about health and well-being, one of which I actually have here, which is Primal Panacea. Now, I first read this back in 2017, and it's absolutely fascinating. So for anyone interested in vitamin C, definitely check out this book. He's also just released a new ebook called Rapid Virus Recovery, and that's free, I believe, for anyone to download. And I'm sure Dr. Levy will share more about how you can do that later in the call. So without further ado, let's get talking to Dr. Levy. So I wanted to start off really with giving the viewers a bit of a background into vitamin C, because obviously since the pandemic started, it's had a huge amount of press, and demand for vitamin C has just skyrocketed. So there's a lot more focus on it. So could you share with us a bit about what vitamin C actually is and what it does in the body, why it's so important for us?
Well, theoretically, a vitamin is something that you can't make and you need to take in certain tiny quantities in order to prevent a deficiency syndrome for whatever that vitamin is. And in that regard, vitamin C is a vitamin because it prevents scurvy, the deficiency syndrome, in fairly small amounts. However, as it turns out, and this is not so much the case with other vitamins, it's more appropriate to call it nutrient C rather than vitamin C, because it's really the most important nutrient in your body that you need in vastly larger quantities than is needed to prevent the deficiency syndrome of scurvy. Scurvy you can prevent with 70, 80, 90 milligrams a day. And there's a lot of different evidence, depending on what you want to look at, to indicate that the optimal dose for an adult human being is more on the line of 8, 9, 10, 11, 12,000 milligrams, or 8 to 12 grams. Why this is because all of the literature indicates that vitamin C is the primary fuel on which your body runs. And it's essential to be in and around every cell in your body because it's what's known as an electron donor. That's what an antioxidant is, an electron donor. And disease is, any toxicity is when something has come along that's taken electrons away or oxidized something. So when you have a toxin or a pro-oxidant that comes along, is seeking electrons because it is electron depleted, takes electrons away from important biomolecules, enzymes, fats, sugars, nucleic acid, you name it. In that oxidized state, that biomolecule becomes inactive and no longer has its normal function. And so the more you have of oxidized biomolecules, the more you have of disease. Disease is nothing more, any disease, than the unique distribution and preponderance of different biomolecules in different locations. And so what does vitamin C come along and do? Vitamin C comes along and either directly donates electrons to the toxin and quenches it before it does its damage, or it goes into the tissues inside the cells, donates electrons to those oxidized biomolecules, brings them back to what's called the normal reduced state, and then they resume their normal function. So in every sense of the word, electrons are the fuel on which every cell in your body runs, and vitamin C is the primary donor. Now, many antioxidants exist and they all donate electrons, but vitamin C is uniquely optimal for dealing with the body's needs because, number one, it's a small molecule and it gets everywhere in the body, inside every cell, across the blood-brain barrier, inside the neurons, everywhere. Part of this reason is because in animals that can make vitamin C, it's synthesized from glucose. So it's got a very similar structure to glucose. And because of that, it actually uses the ubiquitous, present everywhere transporters that exist to bring glucose in the cell, the same transporters used to bring vitamin C inside the cell. So you have a uniquely small size, a unique ability to get into every tissue inside every cell using glucose transporters. And it also donates 2 electrons per molecule, which very, very, very few antioxidants do. So it's got a double whammy impact, if you will, in that regard. So it's very compatible because of its small size. And I think we're going to talk a little about the history of vitamin C. In my books, I've demonstrated that there has never been a toxin or an intoxication or a clinical poisoning that vitamin C could not neutralize and remedy if you use it promptly enough and use large enough amounts of it. That's because toxins are oxidants, okay? And the only way a toxin does any damage to your body, any type of toxin at all, is because of where it goes and which biomolecules it oxidizes in which concentration. That's disease.
That's incredible, because I didn't realize a bit about how small it was. And I heard you talking on another podcast actually about it being similar to glucose, and that it can sort of go everywhere and be, really active like that. And so it's really quite incredible. And I wanted to ask you as well, we'll come on to a bit about the history, but why is it then we don't make, like with vitamin D, which I know isn't technically a vitamin, it's a hormone, but why don't we make it then in our bodies? What's going on with that? Because surely if it's so important, why don't we have the mechanism within our bodies to be able to manufacture it? So
you're asking me now about, as I interpreted, God or nature's design. I'm not exactly sure why the natural powers that be kept us from having the ability to make something, but I don't think there's a organism of any type alive that actually makes every type of thing that it needs for optimal health. So that's, of course, the role of a healthy diet and a good digestion. And that's why so many fad diets and deficient diets can cause problems, is because not just with vitamin C, but with other things, if they're deficient in that, and it's something that your body does not make, then you're going to have problems.
But don't some animals make it? Isn't it correct that some do manufacture vitamin C?
Yes. Practically all of the animals make vitamin C. Except for guinea pigs, fruit bats, and the gorillas and the apes. Okay, these are all animals that don't make vitamin C. The interesting thing about it too, since you brought that excellent point up, is we started out by saying, how much vitamin C do you need? Well, a 150-pound goat, for example, under ordinary circumstances will make 4, 5, 6, 7, 8 grams, 8,000 milligrams of vitamin C. And here's the important part. It's being secreted directly into your blood. It's not coming from a poorly absorbed oral preparation. So if you extrapolate on that and say that goat is making 8,000 a day, when it's not stressed, when it makes more, it needs more. 30, 40, 50,000 milligrams when it faces a big infection or a big oxidant stress. Well, just think how much vitamin C, regular vitamin C, you'd have to take orally to be the equivalent of 8 grams in your blood, probably on the order of 20, 30, 40 grams orally because of the poor absorption of vitamin C. So this is why you really can't overdo vitamin C, is because just about nothing that we have short of intravenous and similar to something else we'll talk about, liposome vitamin C, it just doesn't get inside the body in the amounts that you really need, in the amounts that you would be making if you had the enzymatic machinery in your liver to do it. The animals that make it have a 4-enzyme sequence that converts glucose to vitamin C. The human beings, most of us, lack that 4th enzyme due to a genetic defect, an epigenetic defect, not a matter of coding, but a matter of a reading of it to produce the protein. And so we're deficient. And you know, I like to joke, but it's not completely a joke. We make this vitamin C, or the animals make this vitamin C from glucose. Okay, so what is a big problem for human beings? Problems with glucose, problems with excess glucose, glucose metabolism, advanced glycation byproducts of excessive glucose metabolism in the body.
Which is very aging, isn't it? Yeah.
It's very aging. And we don't see animals in the wild injecting themselves with insulin, do we? No, just as human beings do, because not only have we lost the ability to make vitamin C, we've lost the ability to utilize the excess glucose that we make because it's present there in large amounts, presuming that we have the enzymatic machinery to make the amount of glucose we need on a daily basis, regardless of stresses. So losing this enzyme capacity in the liver is a super double whammy. It's a super double whammy because we no longer have optimal metabolism of the glucose, and we're much more sensitive then to excess glucose intakes with carbohydrates and sugars, and we're not making the vitamin C in anywhere near the amounts that we need for optimal health.
And you mentioned about stress, and obviously a disease can be a stress on the body, but also emotional stress, all different types of stresses. Presumably then we do need more vitamin C at those times. So is it even possible to say what's an optimal amount of vitamin C that we need a day? And is it possible to overdose? I've heard you say that you can't overdose on vitamin C. So, but what's like a really optimal amount? I mean, a lot of the capsules you get are really teeny tiny amounts. So are they even doing any good?
They're doing good. Any amount of vitamin C is better than none. Okay, first start with that. So any amount that somebody can supplement that they would not supplement otherwise is to their benefit. It's sort of it's a numbers game. In any given body, you have a certain amount of oxidation. You have a certain amount of excess oxidation and excess oxidized biomolecules. And your optimal vitamin C dose is going to be enough to take care of that degree of oxidation taking place on a daily basis. And this is different and is widely among different people. I mean, some people could do well on a couple grams a day. Some people would need of regular vitamin C 30, 40, 50 grams a day. Okay, wow. So you just, if you just want to pick a figure that would statistically serve a large percentage of the population, statistically speaking, optimally, I would say something on the order of between 2 and 3 grams, 3 to 4 times a day. And that's the other thing too. Regular vitamin C is absorbed and excreted quickly. So if you take regular vitamin C and you want optimal coverage, you really have to take it throughout the day. And certainly, even if this is not convenient, when you're sick, if you really want the optimal impact, you better just be taking your vitamin C in some capacity every hour until you start to get better.
6 grams a day is optimal. But if it's the powdered sort, is that the same if it's liposomal then? Because I believe that's more easily absorbed. So would you need as much if you're taking liposomal?
No, not at all. The lipo, that's why I qualify between the liposome and the regular oral.
Yeah. So
even though
the powder vitamin C, you might want to be having about 6,000 milligrams, 6 grams a day, split over different, 2 to 3 doses throughout the day.
That's correct. Yes.
And with liposomal, perhaps you wouldn't need as much, just for a maintenance dose.
Well, this has never been worked out, except for, to my knowledge, my personal experience with liposomes starting 15 years ago, and the clinical observations that I made. And my clinical observation at the time was I was sick and I had closed my office. I no longer had access to IV vitamin C. Live On Labs, which makes the same product for Altria that Altria sells in the United States, was interested in me talking about their liposome C and representing them. And I didn't know anything about a liposome. And so I said, sure, send me some product. And then I had nothing to do with it until I got sick a few months later with a real bad case of the flu.
Right.
Didn't have my IV vitamin C, had already taken about 10 grams orally of regular powder and was having such severe diarrhea that I couldn't take any more of that. And I remembered one thing and one thing only that they had told me before they sent that, is they said, and I didn't understand why, they said, well, if you take this liposome, it doesn't have the effect on your bowels. So I said, oh, okay, well, I can get some more vitamin C on board without making the bowels even worse. So I took 5 packets, 5,000 milligrams.
All in one go.
And all in one dose. And then by my experience and my recollection, I had a truly remarkable experience in that within about an hour to hour and a half, I was feeling better, not only than I had in days, but I was feeling better by my perception, than I did after some of the 50-gram intravenous infusions I'd taken.
Wow.
And this was so striking that I said, it can't be true. So I just ignored it, got better. And then I needed to repeat this experience once with me and a couple times with friends before I finally said, well, Dr. Idiot Levy, I think it's about time you do some research and figure out what a liposome is and what the devil is going on here. And so I did a deep dive into the research and the literature and the structure of a liposome and the fact that it's designed to be pretty much an artificial cell, has the same phosphatidylcholine double-walled membranes around it. And interestingly enough, because it doesn't get digested in the traditional fashion, it just goes straight into the microcirculation of the lymphatics of the gut, in the lymphatic system, spills over into the blood, goes throughout the body. And then, very importantly, probably the most important part, is the membrane will then either so tiny it passes into the cell directly, or it goes into the cell wall and merges with the cell wall and deposits its contents inside. And all of this without the consumption of energy. Even when you take intravenous vitamin C and it's directly in your blood, 100%, you still don't have the unique biodelivery of that vitamin C that you have as if you have a liposome circulating in the blood. When you have the liposome circulating in the blood, it gets the vitamin C in without the consumption of energy. When you have it IV, you need what's called active transport to get the vitamin C in. It's not in the liposome, it's just vitamin C. And you need to consume energy in order to get the vitamin C in. So you're sort of robbing Peter to pay Paul, as they say.
Yeah, I heard you talk.
And that's the big difference. So even orally, you're getting more effective delivery of the vitamin C, close to 100%, versus regular oral, where you're getting a very small percent, depending on the amount you're taking, probably anywhere between 10 and 30%, and without this encapsulation process to get it inside the cell without the consumption of energy.
Yeah, I heard you talking about that on another podcast, actually. I thought that was fascinating because, again, it just makes sense then to want to take a liposomal form because it's getting so much more easily where it needs to go, like you said, without energy, because I presume any process that's using energy is going to create some kind of free radicals in the process of doing that. So this almost seems ideal in that it's going, like, did you say straight almost into the lymph so from the gut into the lymph, and then it can.
Well, you see, that's the other interesting thing too, is most things that you absorb go into the microcirculation in the portal venous system, and they have a one pass to the liver where the liver does its job of metabolizing it. In the case of fats, you have protein, sugars, and fats. Yeah. Proteins as amino acids, sugars as saccharides, mono sugars, and you have lipids anywhere from large fatty molecules down to tiny molecules. Well, the liposome represents a tiny fat molecule in terms of absorption. So it doesn't use the amino acid or sugar absorption pathway into the portal blood. It pretty much uses, not exclusively, but largely, the uptake into the enterocyte, which then puts it into the lymphatic circulation. They have something called, as a parallel to the blood capillaries in your body, they have something called ileals, I-L-E-A-L. These are microscopic lymphatic vessels. So the certain types of nutrients go straight into the blood channels, the portal venous, and other ones that are small enough, and the liposomes are small. If they're large, they get processed like the other ones, but the small lipids get taken directly up into lymphatics, into the capillary equivalent in the lymphatic system known as the ileals, and then they converge, go into larger blood vessels, get into the immune systems, because there's many, many, many immune cells surrounding your gut. So that's another big hit, is when you take the liposomes, you immediately start getting an uptake of vitamin C in the monocytes and the lymphocytes. And that which doesn't immediately get taken up, gets taken up, passes on down the lymphatic system until it reaches the thoracic duct and spills into the bloodstream and then goes throughout the body.
Wow. So just the tiny capsule, the tiny, well, yeah, encapsulated vitamin C is just, it's going through a different system then almost to the
completely
you take, and even the intravenous. So would you say then, now having studied it so much, then that liposomal vitamin C really outperforms intravenous vitamin C? Do they have different roles to play, or would you always go for the liposomal now?
Gram for gram, the liposome encapsulated C substantially outperforms the intravenous vitamin C. Now, that said, if you're sick and you have access, you want both, because they also fill different niches. All right. In the case of intravenous vitamin C, that you're not going to accomplish with liposomal vitamin C is when you take a very large megadose, let's say 50 grams of vitamin C, you get a literal flooding of that into the extracellular space. And when you're dealing with infections that you're treating, what you want to do is upregulate inside the cell what's called the Fenton reaction to make something called a hydroxyl radical to kill the pathogen. And this is only stimulated at very high levels by high concentrations of vitamin C, because the vitamin C not only goes eventually into the cell and feeds this Fenton reaction, it's breaking down hydrogen peroxide inside the cell to make this. But at the same time, by physiological reasons I don't understand, that large amount of vitamin C in the extracellular space also allows for the massive new production of new hydrogen peroxide so that it can diffuse inside the cell. And so you keep the reaction going to completion until you get death of the pathogen infected cell. I mean, even those of us who haven't done much in chemistry, I think, appreciate that if you got a chemical reaction doing something that you wanted to do, and you wanted to do it for a long period of time, you have to keep supplying new substrate. You have to, I mean, once a reaction goes among molecules, it's done. So unless you supply more vitamin C, more hydrogen peroxide, etc., the reaction will peter out. So you have something here that vitamin C uniquely helps sustain the reactions inside the cell you need to have the incredible therapeutic effects that it has. So, but like I said too, the liposome has its own unique characteristics. So you want both.
Yeah.
Now, it's really a toss-up for me, in spite of my experience 15 years ago, because I've seen so many wonderful things with intravenous vitamin C, to say, let's just say I'd be equally comfortable if I'm substantially acutely ill with an infectious disease syndrome to take 5 to 10 grams of the liposome C versus a 50-gram IV. But I wouldn't want to have uniquely one or the other. For the reasons I said, I'd really want both, because it's sort of creating an artificial situation to say, well, if you just have one, which would it be? Well, if you have any role or play at all, you want both. Okay.
I guess
and many circumstances you don't have access to both, so you just take what you have.
That's what I was going to say. I mean, I think probably possibly for the majority of people, might not have access to or the funds to do intravenous vitamin C, which I'm sure has gone up in price now, or with everything that's happened. So it's probably more cost effective to get hold of liposomal vitamin C.
And we should jump right into this too right now, which is, hey, I take the credit or blame, however you want to put it, on starting the liposome bandwagon 15 years ago, because nobody was talking about it until Live On got together with me. I gave a few lectures about it. I related the story that I have, and I've seen my story in different forms everywhere on the web. So they just picked that up, comparing liposome to IV. And because of that, what does our capitalistic society do? They want to make money. They see that Live On Labs is skyrocketing, because regardless of my role in Live On, most people feel so much better in general when they start taking just a few grams of liposome encapsulated vitamin C a day, that I don't know what the exact percentages are, but Live On has one of the highest reorder percentages of any supplement in the industry. I mean, lots of people.
You can get it here. There was a time last year when, or it might have been earlier this year, when it was out of stock anyway, and I couldn't get hold of any. And then when it was back in stock, I was like, quick, order some more.
and the point too is, most supplements, everybody's trying something all the time. They'll try one bottle of this and never order another bottle. I mean, probably most supplements, I would estimate, are below 15% reorder. Okay, people try out one bottle, they're through. Well, that's not the case here. So it propagates itself.
Yeah.
The entrepreneurs saw this, the fraudulent entrepreneurs saw this, and now there's a plethora flooding of quote unquote liposomal products out there. We initially tested a lot of them, and they had no liposomes, and it just got fatiguing and expensive testing them all. And it was very clear that most people are just happy to make a large amount of money until they get called down. And when they get called down, they say, oops, I'm sorry. Okay, we'll stop. But I'm not saying there's no legitimate liposome preparations out there besides Ultrian and Live On, but there's none that I'm confident with. Okay. See, the other side of the other problem is testing them to do a legitimate test costs $7,000 or $8,000.
Wow.
Okay, so it's just not something you just throw the money aside, and then if you're doing it for your own satisfaction, the company's not going to stop making the product anyway. What's the point?
Yeah.
And the homemade preparations are not liposomes. However, they form what's called an emulsion, which does allow the regular vitamin C to be absorbed more effectively than vitamin C that's not in this emulsion. But it's not encapsulated. So once it's inside the blood, it does not have the unique delivery capabilities that liposomes have to get inside the cell. So a lot of people that make quote unquote homemade liposomes, they feel better, they like it because vitamin C makes you feel better, okay? And they're getting a lot of vitamin C. But if they're a critically ill patient, an advanced infection patient, and they think they're getting the benefit of liposomes, but they're still going downhill, that's where the tragedy occurs, because they're not using liposomes even though they think they are.
And are there many of these different companies that are making products that they're saying are liposomal and they're not? And how can the public know? I mean, because they're not in the position to be able to test these things and to know.
No.
I mean, what can the public do?
That's why I'm saying if people want to go, well, buyer beware. Okay, I told you as clearly as I can that most of the products are fraudulent.
Yeah.
Whether they're intentionally fraudulent or negligently fraudulent, I can't differentiate for you. The other thing too is people say, when you compare it to regular vitamin C, well, liposome, Live-On and Ultrient, they're a little pricey. Well, let me tell you, they're pricier because it's an incredibly involved process.
Yeah, I bet
not
it
only
is.
to make a liposome, but to do the quality control. And Live-On tests every batch for purity, liposome size, everything else, and so it comes out to more money than
I guess
if you
you
just throw
you
something
get what you
together
pay
in a
for.
bottle and call it a liposome.
Yeah, I guess you get what you pay for at the end of the
Yeah.
day. Well,
So
usually,
bottom line, you say, how are people to know? If people want to trust me, get Altria or get Live-On. Okay. I'm not saying 100% of other products are worthless or not worthless, are not liposomes, because if they have some vitamin C in the product, you're benefiting from that, like we said earlier. So,
yeah.
but if you want the unique benefit of the liposomes and you want to be sure that you're getting it, Live-On or Altria. Okay. Maybe it's available elsewhere, but I can't guarantee that.
And what do you say to, there are a number of sort of medical and health professionals who kind of dismiss vitamin C, even still, even though it's kind of risen to popularity because of COVID and lots of people have been studying it more. There are still some people that dismiss it and say, oh, well, you just pee it out. You don't, you can't absorb that much anyway, and it has no benefits. It's no use to any people that are ill, and they just don't even try it on people. I mean, why would they do that? There seems to be so much more evidence now that of its efficacy and what it can do.
It's a simple explanation. These people are arrogant, aggressive, and stupid, and uninterested in learning anything new. All they're interested in is protecting the status quo. With doctors, it amounts to laziness. Doctors get into their routine, their habit, and they don't want to disrupt that. They also do not want to be told that, hey, there's something you're not doing that's better. Oh, there's nothing that lights a fire up a doctor's butt than you can imagine when you're telling him or her that basically they don't know what they're doing and they're not using an optimal therapy. I mean, it's basic human psychology, although obviously it should be the doctor's higher responsibility to be aware of new advances. Not that vitamin C is new. Everything we're talking about is 80 years old. Okay, but it's arrogance of the highest degree. Okay, and vitamin C intravenously inside the intensive care unit in so many conditions is so profoundly effective. In my opinion, if it were routinely used, it could virtually eliminate over 50% of all prescribed medication. Okay, so just think of what the financial impact is there. Okay, the other thing too, with regard to why doctors do this, is whether they realize it openly or just intuitively, you don't adopt therapies that are going to largely eliminate your practice. Okay, if you're a ICU or pulmonary specialist and basically everything you do is they come in and you prescribe IV vitamin C and they get better, well, you're not that necessary. Your specialty is no longer that necessary. And doctors are not about to basically negate the value or expense or sacrifice they made in getting their education by just legitimately using a quote unquote cure-all. And of course, finally, money. Okay, we got to stop being so deferential toward doctors and healthcare systems. They seek to make obscene, unconscionable profits. Not just a reasonable profit, obscene and unconscionable. And they routinely, with ordinary circumstances where somebody gets in an accident and they come out the hospital 2 weeks later, they lose their house, they lose their savings, they lose everything, and the healthcare and the system and the doctors don't care.
It's a sad state of affairs. Yes, I agree with you. Circling back to, because you said about when it was discovered as well, that was actually the first question I was going to ask, which is if you could tell us a bit about who actually discovered vitamin C and when did they realize that it was such a potent and, beneficial vitamin? Well, you just said it was about 80 years ago or something.
Yeah, it was discovered in the 1930s. I don't know the exact point in time, by a doctor, difficult to spell, but his name is Dr. Albert St. Georgi. And he actually ended up winning the Nobel Prize, I think in 1937, in physiology or medicine for the discovery of vitamin C. And of course, he deserves incredible credit and appreciation for that. But the single person that has to get 99% of the credit for anything that's going on today with vitamin C is Dr. Frederick Klenner, I think he was a pulmonologist. He was a medicine subspecialist in Reidsville, North Carolina. And I have no idea what the backstory is as to how he became aware of vitamin C. I suppose he kept up with the Nobel Prizes and he saw that this new vitamin was discovered, because even though this happened in 1937, very shortly thereafter, he was using not small doses, but massive doses to treat virus diseases. In the middle of the polio epidemic they had there, he uses injectable vitamin C and cured 60 out of 60 cases of polio. But I say, and I would love to know the answer to this, but I don't know. And that is, what went off in Dr. Klenner's mind that said this newly discovered vitamin could be used in massive doses? I mean, as you might say in Spanish, it took a lot of cojones to start giving people massive doses of anything that somebody had never given even light doses of to. But anyway, he figured out that this antioxidant impact of vitamin C just had a miraculous effect. And in fact, as he got to do all his work, and he did over and over and over, he said, vitamin C, intravenous vitamin C in this particular case is so valuable that now when patients come to my office, the first thing that happens is the nurse hooks them up to an IV vitamin C and starts the treatment, and then I come in and see what's going on.
Wow, it's the first thing.
Yeah, first thing, IVC first. So, and then of course, Klenner compiled a large amount of information with a wide variety of diseases. So you had Albert St. George, he discovers it. Dr. Frederick Klenner, with true genius and insight, saw the therapeutic ability and potential and worked at that for, I'm going to say, I don't know, 30 years or so. Then comes along Dr. Linus Pauling, who was interested in the information that's going on there. Dr. Pauling wrote his book about vitamin C and the common cold, and it got a large amount of publicity. And then as Dr. Pauling's was ending the end of his active time, he was not a clinician, he was not a physician, okay? So he wasn't working with patients in the same way. He was disseminating the information. Right. Then came along Dr. Hugh Reardon of the Reardon Clinic in Kansas City, who continued basically what Klenner was doing, high dose vitamin C on just about everybody. And then a decade or so later, Dr. Ron Honeyhackey at the Reardon Clinic has continued what Dr. Reardon started. And, you know, there's people else around the world, but this, in my opinion, is the primary sequence of individuals that put vitamin C where it is today.
Kind of carrying the baton on, and you're definitely one of the ones now continuing to sort of push the message forward. So I do want to be end of that one. Yeah. I wanted to, so talking about as well dosing, we've talked about you can't really overdose on vitamin C, but there are some people that say, oh, too much causes kidney stones. I mean, is there anything to that? Where does that come from, that belief that if you have
Well, first of all, let me say that it's kind of interesting, but after a long time, I came to my own conclusion that vitamin C is very possibly the only substance in existence that has no toxicity. Okay, there's never been a level of vitamin C intake above which is always toxic. So there's no, what do you call it, where half the animals die beyond a certain point.
Right.
No toxicity to vitamin C. And then I use as an example, it sounds silly, but it's true. Water has more toxicity than vitamin C. Okay.
Yeah,
you can drink 2 or 3 gallons of water in 10 or 15 minutes, go into cerebral edema, have seizures, and die. Pure, simple water toxicity. Now, it might sound ridiculous to say water is toxic, but if you took in a large amount of water and now you're dead, you pretty much have to say it's toxic. There is no amount of vitamin C that you can take that will reliably cause a problem. Now, with regard to the very popular and viciously promoted myth about vitamin C and kidney stones. Kidney stones are predominantly what's called calcium oxalate. Over 85% of stones are calcium oxalate, and this is virtually the only stone that we're talking about when we're talking about the commonality of kidney stones. The other ones are much more exotic under other circumstances. Well, vitamin C, along with many other foods and many other agents, will metabolize down to oxalate as it's excreted in the urine. And so they say, well, vitamin C produces high oxalate levels. It's got to produce a large amount of stones. And either intentionally, negligently, or stupidly, they don't even consider the calcium. It's the calcium that's the culprit, okay? Any oxalate you have in your kidneys can be potentially provocative of stone formation if you also have large amounts of calcium. If you don't, there's no problem. And in fact, in the laboratory, in the test tube, vitamin C puts calcium into solution better than just about anything else, including strong acids. Okay, so, and because of this fact, taking large amounts of vitamin C decreases your chances of getting a stone, and it helps dissolve pre-existing stones. Okay. As in so much other garbage we're fed, the truth is the exact opposite of what's being done. Okay, and all you need to do, as if you have a stone problem, is you should cut back on all your sources of oxalate until you've normalized your calcium. Okay, and by taking large amounts of magnesium and vitamin D and vitamin K and also vitamin C to a lesser degree, you start mobilizing all that calcium. And so when you stop taking calcium supplements 100%, and you bring dairy consumption down to a minimal amount, you stop making stones and you start mobilizing calcium and excreting the calcium out of your system.
Right. Okay. So it's the reverse then, basically. Taking vitamin C is going to help you to break down and get rid of the stones. It's not going to be causing them. Wow.
It helps put the calcium deposit back into solution.
Is vitamin C the most important vitamin we could be taking for supporting our immune system?
Yes. And let me backtrack to what you just said. You can't overstimulate the immune system. That's another kind of silly concept that they have out there. What they talk about is like a hyperactive immune system in autoimmune disease. No, it's not a hyperactive immune system at all. It's a normal immune system reacting to an antigen that you're not removing from the body. So it just keeps on reacting to that antigen. But the immune system itself is not hypercharged. It's just chronically reacting to something that you won't get out of your body. And most autoimmune diseases come from infections in the mouth, infected teeth, infected gums, infected tonsils, infected sinuses. And they facilitate the ability of the body to form antibodies against normal parts of tissues that are chronically infected, because the infection changes the physical nature of the tissue. Then that tissue is represented as non-self, and the immune attacks it until you remedy the infection, you're never going to get rid of the condition. Some 25 years ago, Dr. Hal Huggins, who first started me on all this, had a clinic in Colorado Springs, Colorado. People came in from around the world. And on more than one occasion, I saw people come in with elevated anti-nuclear antibody tests. Okay, and that's how they follow lupus and other things like that. And generally speaking, once those levels go up, they never come down. I mean, you might make them a little better, a little worse. I would routinely see those levels plummet or normalize within 2 weeks because he got all of the toxins and infections out of the mouth. Okay, so they're not, modern medicine, quote unquote, on the modern, considers autoimmune diseases to be incurable and basically unable to significantly put them into regression. And it's all because they still don't recognize the fact that it's chronic infections causing the chronic antigen stimulus that your immune system won't stop reacting to.
So it's not just your body going crazy and deciding to attack itself. Which
No.
Theory of why would your body do that? It must be doing for a reason. It's not just suddenly going, oh, I'm going to attack my thyroid, or I'm going to attack this part.
And where is your thyroid?
Well, yes, right here under there.
Sitting right under there, draining all the toxins and pathogens in your mouth. Hashimoto's thyroiditis, virtually 100% a dental issue.
Wow. So let me bring it back to, because I went off a bit, that's my fault, to immunity and vitamin C then. And you said at the beginning there, yes, you feel that vitamin C is the most important vitamin when it comes to supporting your immune system. And did you want to sort of qualify that a bit more?
Sure. As I said at the start, all disease is excess numbers of oxidized biomolecules, all disease, okay? The immune system is designed to alleviate inflammation and alleviate disease. Now, inflammation is virtually interchangeable with acute focal vitamin C depletion. So anywhere you have tissue that's inflamed, you have large amounts of oxidation, and that large amount of oxidation is using up all the vitamin C in that area. So acute inflammation is always, if you will, acute tissue scurvy. Okay, just focal there. Now, when you take a normal tissue and you inflame it and you start putting toxins and pro-oxidants in there, using up the vitamin C, it triggers an acute immune response. And what's the first cell to show up? It's the macrophage, the monocyte. The monocyte has 80-fold, 8,000% more vitamin C inside it than surrounding it. So it's literally a high concentration package of vitamin C that's being delivered to the area of the body that's being acutely depleted of the vitamin C. Now, I'm not going to deny that I'm glossing over a lot of things, and some people will say, oh, that's too simplified. I'm going to tell you, and this is my opinion, okay, versus validation. It's my opinion that the primary role of the immune system is to supply vitamin C and antioxidant impact where it's been acutely depleted. That's it. Now, when you have a stress reaction, okay, and you get the adrenaline and everything, well, what does all of that do? Well, it releases cortisol from the adrenal gland. And one of the primary things that cortisol does, little known, is to avidly increase the uptake of vitamin C into cells. So you have the cortisol at the same time, you get a surge of glucose that your body should be metabolizing into vitamin C to be part of your stress response. Okay, so that's another thing that we're deficient in because of the enzyme deficiency in the liver, is our fight or flight reaction, if you will, is severely impaired because you should be getting a massive surge of vitamin C in your blood that the cortisol can then work on to push inside the cells.
So stress is just depleting vitamin C even more, I guess.
Absolutely. Absolutely.
Yeah. And so in your book, Rapid Virus Recovery, which, by the way, how can people get hold of that if they want to download a copy of that?
Okay, the website is simple. It's RVR, V as in Victor, RVR.medfoxpub, medfoxpub.com. So rvr.medfoxpub.com. It's also available in Spanish. Okay, so you just pick the right button to download it.
Yeah.
And anybody that goes on there, the only price of the download is you got to forward that to all your other friends in your email lists so they have the opportunity to see the information too.
And in the book, you share some other, as well as vitamin C, you kind of talk about a whole host of vitamins and minerals that are great for the immune system. Did you want to touch on any of those, such as vitamin D, or things that can then help support vitamin C as well?
The primary intervention of the book is talking about hydrogen peroxide nebulization that helps remedy any viral infection, any pathogen you have in your aerodigestive tract, your nasopharynx. And it's very interesting, and I only stumbled upon it, even though I've been working with vitamin C all these years and just started working with hydrogen peroxide. Hydrogen peroxide and vitamin C are natural partners. I just told you about the Fenton reaction where the vitamin C brings in the electrons to relay and break down the peroxide and form the hydroxyl radical to kill pathogens, sometimes cancer cells, as the case may be. So they're natural partners. The peroxide is naturally produced inside the body. You're just using something like so many things when you get sick. It's not because your body is not helping you recover. It's because your body cannot do enough of what it needs to do to get you to recover. So using the peroxide, you're just augmenting a natural response of your body. But you have the hydrogen peroxide, you have the vitamin C, vitamin D is very critical.
Is there Magnesium? I'm sorry, I was just going to say quickly on vitamin D, is there an ideal form in which to take that as well? I mean, the British government is talking a lot about, they're actually sort of encouraging people now to take vitamin D. I don't know whether they're encouraging a high enough dose particularly, but is there a particular sort of format for that? Obviously there's different types of vitamin C, or I think there's two types of vitamin C, aren't there?
There's only, that I know of, two types of D. There's D3 and D2. The D2 is not a natural D, and you don't really want to take that, and you won't get the same amount of benefit. The D3, very, very inexpensive, probably one of the cheapest supplements there is. And most people should be in the range of about 5,000 units a day. Some people a little bit more, maybe a few people a little bit less. And what do I base that on? I base that on the amount that it takes to get your blood level above 50 nanogram per cc. It's a regular blood test. and you just see if you're 50 or above. But it's nanogram per cc because they have another index that's much lower. And if it's 50, you're still too low because it's lesser than the other nomenclature. But nanogram per cc, 50, above that is what you want to shoot for. Okay. And there's just an enormous amount of literature demonstrating not only for infections, but for a wide variety of illnesses. Vitamin D deficiency is strongly associated with cells proliferating for no reason at all. Well, all of those things. So you have the vitamin C, the vitamin D, any of the vitamins and minerals are good, but the magnesium is important too. And let me clarify, everybody always says, what type of magnesium? Well, in supplementation in general, the cation is the positive, the anion is the negative. So magnesium is the cation, chloride is the anion, all right? Almost all supplementation, they ignore the anion completely as far as value or negativity of the supplement. So you have magnesium sulfate, magnesium chloride, magnesium citrate, magnesium threonate, blah, blah, blah. I say, what should I use? Well,
yeah, I'm always wondering that.
They're all good for getting you magnesium, but look at the anion also, especially when it comes to infection. The chloride ion is extremely important in anti-pathogen activity, okay? I mean, if you recall, or maybe you don't, maybe your mother told you when you were younger, you start to get a sore throat, gargle with salt water, okay? Gargle with a little sodium chloride. Well, it's the chloride, okay? With regard to viruses in particular, in the test tube studies, they showed that magnesium chloride would completely suppress virus replication, while magnesium sulfate increased viral replication. Well, it wasn't the magnesium that was doing it, it was the sulfate and the lack of the chloride. So, I mean, you still want to, even outside of the situation of being infected, you want to take magnesium on a regular basis, one of your most important supplements there is. But in the setting of giving yourself immune strength against infections, you should make it magnesium chloride. In one of my recent books, Magnesium Reversing Disease, I show all the evidence where magnesium chloride taken orally by itself appeared to be as highly effective as the injectable vitamin C that Dr. Klenner used to cure polio.
Wow.
And not only to cure polio, but to help reverse chronic polio that people had already had for months and was starting to have paralysis of their limbs. So it's an incredibly important and incredibly cheap supplement, magnesium chloride.
And then
and of course, in the setting of the pandemic, you want a zinc source too.
Yeah, just with the magnesium then, is that better as a liposomal formulation as well then, as opposed to, because I mean, I get sent a lot of supplements and trying to decode and work out which ones are going to be best is just a minefield.
Well, right now, the only
magnesium oxide, I think, is the sort of the cheapest one. Is that correct to say? It's sort of, and it can irritate your stomach a bit sometimes, I think I've read.
Possibly in some people.
Is it better than, therefore, along the same lines as the vitamin C? Would you want to take that as a liposomal form then for better absorption than a sort of a hard capsule or
well, right now, to my knowledge, Live On is the only company that even makes an encapsulated, or
are they the only one that does it?
Professes to make a liposome encapsulation. I mean, maybe there's some other companies out there saying they do, and they encapsulate magnesium threonate, okay? And the threonate by itself, outside of the liposome, is much better to getting inside the brain. The interesting thing about it is because I had suggested about maybe 4 years ago to Live On that they try to encapsulate magnesium because, like vitamin C, it's not well absorbed, and you'll start getting loose bowels long before you get enough magnesium in your body. And I I think the first thing they tried was magnesium sulfate. And lo and behold, when they put the sulfate inside the liposomes, it started generating heat and breaking down the liposomes. I mean, there's just some chemical things that you can't predict when you're starting this up. And so they tried some other things, and the magnesium 3 and 8 was quite stable. So they went with that.
I think they might try it with the chloride then.
That'd be great. Okay, but the other thing too is the magnesium chloride is pretty well absorbed, and even so, if you're because like I just said with the example of the polio patients that was in France, they weren't having to take huge doses of the magnesium chloride to get this effect. So I should probably back off and say that the magnesium is a little easier to dose in its traditional forms, maybe, than the vitamin C.
Just quickly with vitamin D again, I wanted to ask, are there any things that help its absorption if you take it with it? Because I've noticed some supplements coming along that have got things added into them as well. So you've got vitamin D and other things added in. Are there, what would you say helps it to be absorbed in terms of ingredients?
I can't say this with authority, but I think magnesium. Okay. The thing too is you also need to take a balance of the supplements. There are some people, and I don't know that the mechanisms have really been worked out well, that it is very hard for them to get their vitamin D levels up. Okay. And as long as the vitamin D levels up, I'm not aware of any toxicity with regard to vitamin C. So people like that can push themselves up to 10,000 units a day. The other thing too is magnesium.
Is it important to have vitamin K with D as well? I've seen the two combined in some things. Do they work synergistically?
Well, the four most important: calcium lowering, oxidative stress lowering, life extending, all-cause mortality decrease supplements are magnesium, vitamin C, vitamin D, and vitamin K. Okay, and that's because they bring calcium levels inside the cells down. All diseases with the increased oxidative stress have elevated intracellular calcium levels, and until you get them down, you're not going to modulate the disease or make it better. This is all covered in a book of mine in the past. I wrote 2013, Death by Calcium.
Which is next on my reading list. I definitely need to do something on that, because it's crazy. Everyone's prescribed calcium supplements, it seems to be anyway, and you think, because you've got osteoporosis, take some calcium supplements. I wanted to ask you as well if you can tell us about any new, obviously back to vitamin C, it rose to popularity from the pandemic, and I did see that China were doing some studies into that, and we did actually put something on the Top Santé website about it way ages ago, and then that all seemed to go quiet. But are there any other people doing more clinical trials at the moment with vitamin C? Are there any new studies that have recently been done or are being doing currently that you're aware of that people are looking at?
There's quite a few going on. It's very interesting what you say about China, is because, without getting into how the whole pandemic started, China has been vastly ahead of the rest of the world in vitamin C research and in using vitamin C for all the conditions that arrogant, stupid US doctors stand on their haunches and refuse to give. Okay. Now, I'm not pro-China, but I'm anti those type of US docs. So let's keep that clear. Well, at the beginning of the pandemic, when it even started hitting China, there was a report that a major most vitamin C is made in China, incidentally.
Oh, is it?
Produced in China, far and away. And a major plant in China that produces the vitamin C arranged to have 50 tons of vitamin C powder delivered to Wuhan. Wow. Now, if you delivered 50 tons of vitamin C to any city in the United States, it would sit there until it turned yellow and got bad. China, though, knew what to do with it. They know what vitamin C does in infectious diseases, and they have a lot of papers on it. Now, I think the FDA really screwed up because very early on, I don't think they realized how quick certain things would turn on, but kind of like before they knew about it, few people writing some papers, few people talking. Next thing you know, vitamin C disappeared off to every shelf, Walmart, everywhere around the country. It took off like wildfire. And for reasons that are unclear to me, but I'm very appreciative of the fact that it occurred, a whole system of hospitals in New York, some 20, 25 hospitals in a group system, started intravenous vitamin C trials. I think it was because China very early on started publishing their experience of vitamin C. And so the New York system was uncharacteristically open-minded for a United States institution with regard to vitamin C, and decided to see what was going on. And then it sort of blossomed from there, okay? Then next thing you know, the good Dr. Fauci, this was a year and a half ago, admitted, yeah, I take a gram of vitamin C a day and this and this and this. And so little things like that got it in the public eye. I don't know what the numbers are now, but I would hazard a guess that whatever the number of people that supplemented vitamin C before the pandemic, it's gone up between 5 and 10-fold.
Yeah.